Medicare insurance premiums. How much is it going to cost you? Hello, I am Kevin Canals with InsureMeKevin.com, an independent health insurance agent in California. And I help people transition from maybe Covered California or an employer group plan into Medicare coverage. And a question that is always brought up is, how much is this going to cost me? I need to budget. They know how much their health insurance premiums are before they transition into Medicare, but once you turn 65 or you leave that employer group plan, it's unknown exactly how much this is all going to cost. What is Part B and A and D? So I am going to focus on the insurance premiums for these different parts of Original Medicare, not the cost of healthcare services under these different plans, but the insurance premiums for budgeting purposes. So Original Medicare is comprised of Parts A and B. Part A is the hospital insurance. And if you have worked 10 years, 40 quarters, and paid into the Medicare taxes, or your spouse has, then Part A will be zero cost on a monthly basis. If you have less than those 40 quarters of work credits, then you are going to have to pay $285 per month, and this is for 2025. If you have zero work credits and you don't have a spouse that contributed to the system, then if you want to buy Part A of Original Medicare, it's $518. Now, Part B is a little bit different. Part B covers the outpatient services, doctor's visits, labs, tests, x-rays, and there is a set monthly amount for individuals based on your income. So in 2025, an individual in their last filed tax return is less than $106,000, or they are married filing joint and that income is under $212,000, it's going to be $185 per month. You can't get away from it for the most part, but it's going to be $185. Now, you also have to remember that if it's two people in Medicare, you and your spouse, it's $185 for each of you. But they determine the Part B cost on the household income if you are married. And you can see if the income goes up to $133,000 for an individual, you're going to be paying $259. Household income for a single individual up to $167, you're $370, and then it keeps going up. So, up to $200,000, you're looking at $480, and then the highest level over $500,000 for an individual or $750,000 for a married couple, it's $628.90 per month. And this is what they call the income-related monthly adjustment amount. These are actually specific numbers that are added on to the $185 amount, but it's the IRMA as a shorthand. Now, the Part D drug plans also are subject to that IRMA, that income-related monthly adjustment amount, and it goes on your income just like Part B. Why? Because the federal government subsidizes both Part B and Part D, your prescription drug plan. But with the Part D drug plans that are all issued by private companies, their monthly premium can be very low to very high. So what I'm showing is what you will pay in addition to the monthly premium for the drug plan you have selected. So for an individual, again, under $106,000, there will be no additional costs, no IRMA. But once you go between 106 and 133, you're going to be hit with $13.70 as a income-related monthly adjustment. Up to 167, you're looking at $35.50, and then you can see up to $200,000, an additional $57. Up to $500,000, $78.60, and if you earn over $500,000, you can expect an additional $85.80 in addition to your Part D drug plan. And both the Part B and the Part D, there's slightly different amounts if you do a married filing separately tax return. And again, this IRMAA is for both individuals in the household, you and your spouse. You'll each have that IRMAA added on to the Part B or the Part D drug plan. Medicare Advantage plans. Medicare Advantage plans comprise all of the benefits of Part A and B. You must have A and B to be enrolled in a Medicare Advantage plan. So any income-related monthly adjustments are going to be in addition to the Medicare Advantage plans. And the Medicare Advantage plans, most of them include prescription drug coverage. So if that is included and you have an IRMAA on your Part D, you will get billed for that even if the Medicare Advantage plan has a $0 monthly premium. And actually, there are a lot of plans with a $0 monthly premium. I was looking at Los Angeles County, 73 different Medicare Advantage plans with drug coverage. 8 of those plans had a monthly premium. There were 65 plans that were $0 per month. Nevada County, rural county up in Northern California, only 5 plans available. Only one of those plans actually had a monthly premium with it, and the others were 0. So, and if you enroll in a Medicare Advantage plan, you know, all of the claims for your medical expenses go through the plan. They don't go to Medicare to be paid, they go through the plan. And the Medicare Advantage plans can help reduce your out-of-pocket expenses for healthcare costs. Some people are interested in a Medicare Supplement. So again, you must have Parts A and B. There is no drug coverage with a Medicare Supplement plan. So that's always going to be separate. You're going to have to enroll in a separate Part D drug plan. Now, these rates are kind of, if you're 65 years old, just coming into the system, most of the rates for the first 10 years, they're gonna go up based on your age. The monthly premiums for the least amount of coverage, which is noted as Plan A, that's going to be around the $110 per month range. The highest level of coverage a Medicare beneficiary that turns 65 in 2025 can get is Plan G, and that could be upwards of $175 per month. Now, these are ranges for a variety of different carriers, and even within California, there may be 3 or 9 different rating regions. So, you know, Plan A in one region may be a little bit higher than another region. And of course, there is the age-related amount. So if you've left your group plan and you're coming in at age 70 into Medicare, you're going to be paying more than this age band. But there are discounts, and that's what makes it kind of difficult to sometimes compare. There can be discounts if you do auto pay, and discounts if your spouse is also on the Medicare Supplement plan. Some of those are upwards of 10% per month. And then there's a new to Medicare discount for some of them. So you may actually see much lower costs, monthly premiums for these Medicare Supplement plans as you transition in, at least for the first year. But it kind of gives you a range of what we're looking at. But let's put all this together and see what it looks like. And this is, you know, probably 70–80% of the people are going to fall into Path 1, I call it. Part A, 0 cost because you've worked 10 years or your spouse has. Part B, $185, because you're not making over $106,000 individually, or $212 as a married couple. You decide you want a Medicare Advantage plan, and you select a Medicare Advantage plan that has a $0 monthly premium. That includes the Part D prescription drug plan. Now, if you have a Medicare Advantage plan, you cannot enroll in a Medicare Supplement plan, so that's not applicable. So your total monthly premiums in this particular situation is $185 per month. Now, there's no dental or vision with that for the most part. Sometimes the Medicare Advantage plans can include it, but no dental and vision, so $185. That may be higher than what you're paying through Covered California, or it may be lower. It all depends on the income. And of course, there may be additional charges for the income-related monthly adjustment amount. And if you have delayed enrolling in Medicare, there may be some late enrollment penalties. Path 2, as a comparison, Part A, 0, Part B, 185, you decide not to enroll in a Medicare Advantage plan, but go for a Medicare Supplement plan. You want to stay in original Medicare. So you need a Part D drug plan. Now, those costs can be all over the place, and I've seen them as high as $185 and under $10 per month. I think the national average, they say, is around $40, so I'll hedge and call it $50 per month. And you want the very highest level Plan G Medicare Supplement, $175. Again, you'll probably find it a little bit less, but when you total all of that up, you're looking at $410 per month. Some people, shocked, because their Covered California plan may have been $0. Other people, they're just really happy. Other folks are kind of like, why am I getting hit with a high Part B income-related monthly adjustment amount? And that can happen because Social Security looks at your last filed tax return from the year before, and if you had sold a home or something like that, or had a real high income, but that will fall away. So how do you reduce these health insurance costs? Well, you can go through Social Security and apply for the low-income subsidy that may reduce your Part D premium and Part D drug costs. Now, the income thresholds for the Social Security low-income subsidy are higher than the Medicare Savings Program that is administered through Medi-Cal. So you can also apply for the extra help through Medi-Cal, the Medicare Savings Program, and if you qualify there, you would naturally get the Social Security low-income subsidy. And there's a couple different levels. I'll just focus on two for the Medicare Savings Program. Qualified Medicare beneficiary will cover your Part B premium, so it would make that $0, and covers the costs of original Medicare, the deductibles, co-pays, and co-insurance. If you're a specified low-income Medicare beneficiary, they'll cover the Part B premium. So that would be $0, but they're not going to cover the cost sharing. But I encourage you to apply so you can see if you're eligible, because if you don't apply, you won't know. So, and that is kind of path 3 for many people. If you are determined eligible for the Medicare Savings Program, maybe a qualified Medicare beneficiary, you can have a Medicare Advantage plan, but you know that your costs are going to be drastically reduced. You don't have to enroll in a Medicare Advantage plan or a Medicare Supplement plan because Medi-Cal is working as that supplement plan, and the Advantage plan, they're picking up all the costs. So that could be very helpful for people with low incomes. So a lot of different moving parts, income related, but it is good to sit down and kind of get a feel for how much this Medicare health and drug coverage is going to cost you before you segue into it, just for budgeting purposes. So if you have any questions or comments, you may leave those down below, and I will do my best to answer those questions. Otherwise, for InsureMeKevin.com, I'm Kevin Canals.